If you ever found yourself asking, who should I consult for my mental health issues? A psychiatrist, a psychologist, a therapist, or a counselor? Don't worry. It's a valid question, and honestly, it can be pretty confusing. So let's break it all down step by step. By the end of this video, you'll know exactly who to approach first, what they do, and how they can help you with your mental health concerns. So now, let's start by explaining the difference between all these professionals. Psychiatrist. They are medical doctors. They've gone through medical school and understand the biological aspects of the brain. So when you have more severe conditions like schizophrenia, major depressive disorder, or severe anxiety, just talk therapy might not help. There is a structural or functional issue in the brain, meaning the way different parts of your brain communicate isn't working right. In such cases, a psychiatrist diagnoses and prescribes medication. They treat the chemical imbalances that could be affecting how your brain functions. Psychologist. They're not medical doctors, but they have a PhD or clinical psychology degree. Their focus is on understanding your thoughts, emotions, behaviors, and mental patterns. They work closely with doctors to diagnose conditions. Let's say you've been dealing with trauma or anxiety, or you want to understand your behavior better. That's when you will seek help from a psychologist. Psychologists won't prescribe medication. They focus more on therapies like cognitive behavioral therapy and other therapies to help you manage your thoughts and emotions. Therapist. The word therapist is a broad term and that can refer to different types of professionals like psychologists, counselors, or social workers. All of them are trained to do talk therapy, but their approaches and expertise can vary depending on their background. Therapy is about understanding the patterns in your thoughts, behaviors, and emotions. It helps you dig into the root causes of what's bothering you and teaches you how to manage or modify these behaviors. Whether it's learning to cope with your stress, improving your relationships, or dealing with emotional challenges, therapy gives you practical tools to make changes in your life. But it's important to know the expertise of the therapist before going to them. For example, if you're dealing with trauma, you may want a therapist specialized in trauma therapy rather than a general counselor. This ensures that the treatment is effective for your specific needs. Counselor. They usually focus on specific issues like career problems, relationship issues, or stress management. They won't diagnose complex mental health disorders, but they are great when you just need someone to talk to. They can help you figure out what to do next and give you strategies for your life challenges. But here's something important. It's not a one-size-fits-all situation. When it comes to mental health treatment, one approach is usually not enough. Your needs will depend on your disorder and how severe it is. That is why treatment often involves different professionals. Why? Because each one brings a different type of care and together they create a balanced treatment. A good professional will guide you towards the right treatment even if they don't handle all the parts themselves. But remember, mental health treatment isn't one-sided. You need to be an active participant. Here are 3 key questions to ask when you seek help. Number 1, what's my diagnosis? That is to understand the root cause of what's going on. Number 2, what's a treatment plan? Ask about the number of sessions, the type of therapy, and if medication is needed. And number 3, how do I track my progress? Know how to measure improvements along the way. To sum it up, if you've been unsure about where to start or who to turn to for your mental health, the most important step is simply reaching out. Don't let the confusion about titles stop you from getting the support you need. Your mental well-being matters, and there's always someone who can guide you in the right direction. Take that first step today. You don't have to figure it out all alone. Reach out, ask questions, and start your journey to better mental health. Thank you for listening.